Things They Won't Tell You: An Introduction into Trans Sex Education. A curriculum by David Semino, Jerry Beamer, Drew Pierce, Quinn Brown, and Garland Caldwell. The selected population for this curriculum would be young adult, trans, and non binary individuals. The developmental level would be emerging adulthood, ages 18 to 25. The rationale for this program would be that most sex education curriculum is geared towards cisgender and straight people, with transgender people not getting the information necessary for their own bodies and sexual experiences. So it's the goal of this program to offer a traditional sex education. The learning objectives for this program are: members will be able to identify knowledge of safe, consensual, and informed sex practices. Participants will have knowledge and demonstrate knowledge of preventing and treating sexually transmitted infections. Participants will be able to define, identify, and alleviate dysphoria. Participants will be well versed in how to support their partner and aware of how dysphoria can impact sexual relationships. Participants will be able to identify available toys, clothes, and practice to be more confident in sex and receiving, in addition to giving pleasure in a gender affirming way. Friends and family of transgender and binary individuals should have a working understanding of how to communicate about relationships, consent, and otherwise support their sexual health. The proposed length and modality is going to be based around 5 sessions, participants receiving a pamphlet overview on the topics, with online accessible links to provide further resources. A feedback form will also be provided at the end of each issue for users to report knowledge gained, access to outcomes, and then to provide any comments or suggestions. Each session will also provide additional activities and information for possible facilitation of an in-person group in the future. The proposed outline of this curriculum would be consent and communication, staying safe, alleviating dysphoria, sex and pleasure, and then friends and family, while also supporting transgender and non-binary individuals in their emergence into sex and discovery as young adults.
In this issue, participants will learn about the vital component of consent in a sexual relationship. Consent has predominantly been understood from a traditional, heteronormative, and privileged body perspective. This issue will focus instead on the education of consent from a sexually diverse perspective that encompasses sexual identity, sexual orientation, gender identity, race, and ability to meet the needs of sexual education topics for sexual minorities. An optional group facilitation will have the opportunity to role play consent and learn the differences in the types of consent. Since saying no can be an issue in relationships of unbalanced power, especially in the trans and non-binary communities, participants will be given a wide variety of scenarios in which they can practice saying no. Because the conversation around consent has largely a binary approach in sex ed programs, our participants will learn that it's okay and often necessary to create their own definition of what consent looks like in regard to their own body. At the end of the issue, participants will begin to develop their own consent identity to better understand the intersectional views of sexuality, negotiation, and the execution of a sexual act. And participants must understand that consent is an ongoing transactional practice that takes place between partners, and it may change from moment to moment. Consent should always be clearly and freely communicated, have an affirmative expression, and respect the boundaries of all parties involved. Consent is not ever given by individuals who are underage, under the influence of an intoxicating substance, or asleep or unconscious. Additionally, consent is not present in situations that involve an unequal power of dynamic.
This section is on toys, tools, and clothing. For this issue of the guide, our readers will be introduced to a variety of sex toys, clothing, and tools that can be used for both pleasure in masturbation and sex, as well as for gender affirming sexual experiences and just daily experiences. An objective here is to emphasize that sex toys and tools, though often marketed in specific ways, can be used in all kinds of various ways for our audience. We'll also be showing in this guide how to take care of toys and tools, cleaning them, what kinds of materials one should look for, and then where to find them. Here is kind of an overview of the sex toys and tools that will be introduced, and they kind of go over what they're used for, how they're typically used, um, and some tips about them specifically. And there'll also be a section on wearable tools, which will be shown in the sample at the end of this slideshow here. Material safety, so talking about what materials of tools are safe, and if you're going to use tools that are made from material that's not body safe, how to use that safely. There'll be a section on cleaning the tools, how to keep your toys and tools clean and keep the material from degrading. And then finally, there'll be a section on shopping for toys and tools, where you can find gender affirming resources for sex toys and tools, and also where you can find free and affordable toys and tools. Finally, here we have a little sample. This one is specifically on the wearable toys and tools that are used for gender affirming experiences. We have ways to simulate body parts, ways to conceal body parts, reduce the appearances. And you see at the bottom a little spot that says, be sure to check out the resource page for where to purchase. Again, we want to provide access in this material as much as possible.
This is guide 3 for dysphoria. For this guide, participants will learn what the term dysphoria means and what the difference between a diagnosis of gender dysphoria is versus the feeling of dysphoria that can be experienced by trans people. Participants will explore the idea that the feeling of dysphoria can be viewed as a social construct and it is exacerbated by encounters with misgendering, barriers to care, and other harmful assumptions. Participants will be able to discuss what dysphoria feels like to them and discuss how these feelings impact relationships and how they can support a transitioning partner. Participants will be introduced to strategies to counter dysphoric feelings. Within the option facilitator, course participants can experience a role play activity to model what alleviating dysphoria looks like in practice. Participants will be introduced to the concepts of gender euphoria. Participants will be able to discuss how to handle feelings of dysphoria during sex, as these feelings can cause great discomfort for trans individuals. At the end of the session, participants will be able to define, identify, and alleviate dysphoria. Participants will be well versed in how to support their partners and be aware of how dysphoria can impact a sexual relationship. The word dysphoria is used in general to describe discomfort, distress, and unease. For trans people, this kind of distress may be associated with our gender, our bodies, or how those around us perceive our gender, and so is often given the name gender dysphoria. Some trans people feel dysphoria as overwhelming or all-encompassing, while others don't have any dysphoria at all. Many find this will change over the course of their life or throughout gender affirmation. Whatever you feel and wherever you feel it, you are valid and valuable. And this is a brief handout on dysphoria, which will be the basis of one of the sections in this lesson. We'll prioritize emotional self-care. We'll talk about expressing your sexuality. Gender dysphoria is different for everyone. Notice when you're feeling dysphoric. Set clear boundaries, figure out what feels good for you, and then experiment with new ways of interacting with familiar parts, as well as practice active and ongoing consent. Another activity that will be in the dysphoria module, a genderbread person activity. It's a low trust activity that's relatively quick. We're just requiring handouts, pens, pencils, a whiteboard with paper and markers. Each person will take their genderbread person, fill it out in meaningful ways to them. This can be discussed or have participants reflect on it for themselves. Participants will know at least one reason why this is helpful and to recognize these different components within gender. Participants will be able to describe the difference between biological sex, gender, identity, gender expression, and attraction. Lastly, participants will be able to understand that there's a difference between gender and sexuality.
Welcome to the second guide in our 5-guide series. So this guide is going to be about staying safe and what safer sex practices can look like for trans and non-binary individuals. So first, we're going to go over meetings, encounters, and safe sex practices. So the idea of trusting your gut, practical things like getting face pictures, phone numbers, or doing a video call with potential partners if meeting them online, meeting in public spaces when meeting in person. If you plan to go home with somebody, then getting their address and phone numbers and sending it to support, introducing introducing them to bartenders, acquaintances, or friends, and letting your friends know where you're going to be for your safety, and letting the partner know that you will be sharing that information with them. In addition to that, we can go over the use of technology. So that can be things like silent alarms to friends and knowing when to call, what to say, and what to do if you don't answer the call or you get that silent alarm. In addition to this, we're also going to talk about disclosing. So that you don't need to disclose, but if you do, what safe practices look like for that, whether it's in person, you want to do that over the phone, or in a public place, or during sexual encounters. So we kind of go over all of that in the guide. The next part of the guide is going to talk about contraception and preventative health. So that's external, internal, dental dams, gloves, all of those things, contraception and birth control options, being aware of early signs of HIV, and finding a regular testing location that you're comfortable going with, booster that preventative health. In addition to that, we provide some resources for gender affirming pelvic exams, as well as regular medical exams, which are important for your health. We start to destigmatize STIs, that they can happen, how to stay safe, how to test regularly, and when you need to notify your partners. To the right, you can also see one of the visuals that we use in the guide, which is turning a regular condom into a dental dam for external use. So there's a lot of options. We want to give the people using this guide the opportunity to have that variety so they can really be empowered in their choices that they make for safer sex practices.
In this bonus guide, significant others, family, friends, and allies to trans and non-binary people will learn how to support their loved ones. There's no perfect way to support someone in the trans community. It is a diverse and complex melting pot of racial, political, religious, and ethnic backgrounds. There's no one-size-fits-all approach to communicating with someone in the trans community. Participants will learn how to have conversations about relationships, sex education, and consent. Continuing education resources will be readily available. This guide aims to provide relevant information to support trans individuals. Things to remember to be a good supporter. You don't have to understand everything to respect their identity. Use proper pronouns and names. If you mess up, give a simple apology. Be careful and considerate about questions you may ask. Avoid compliments or advice, such as, you should learn how to do your makeup better. That way you can present as a woman or a male, or however you decide you want to be that day. You're responsible for furthering your education. It is not your friend or family member's responsibility to educate you. Resources and additional information will be available in this guide. Communication and safety. Dating is scary. Practical safety and sharing, and being open to that. You don't have to know all the specifics about their relationship. Ask them the location and phone number if they are on a date or a meetup. Set up a silent alarm system with them, such as texting and giving a phone call. Let them know that you are here for them. If you notice any intimate partner violence, do not be afraid to ask about it. To the right are statistics of IVP. Here are some resources, such as hotlines and support groups. SOFA, significant other, family, friends, and allies to trans and non-binary people, have a support group that is open on Facebook. They also have an online group via Zoom. All the information is within this resource.
Ethical and cultural considerations. Insurance barriers would be the first consideration to make. In general, LGBTQ patients are more likely than heterosexual patients to be uninsured. Even patients who have health insurance and visit medical providers who can provide competent care may still face insurance denials because of gender markers in their patient profile. For example, any insurer could deny coverage for a trans masculine person seeking birth control because contraceptive care does not align with what the insurance plan categories as male or men's health services. Local fundraising or grants could alleviate any issue with out-of-pocket expenses or possibly help with insurance. Next would be cultural competency. To ensure counselors are adequately trained in LGBTQ competency, any participating staff will complete a cultural competency certification prior to the program's start date. This will be required to ensure clients are being educated based on the most current research and standards of practice and guidelines on inclusivity. Safety, the hugest consideration. Client safety is of the utmost importance, therefore issues with privacy, consent, and duty of care must be addressed. Lastly, we have our references.